Hello, welcome to the second video on Triphala, the timeless healer. I'm Dr. Suchita Mukherjee, and today we are going to talk about Triphala again, but in respect to diabetes, in respect to gut health, in respect to cardiac health. Very important topics. So please watch the entire video, share your comments, share your feedback, share it with others who can benefit from this, and try to incorporate Triphala into your lives. So the reason for making these videos is to help us all understand how Triphala works. Most of us have heard it. It's a very common household name, a big favorite with all Ayurvedic practitioners. And mostly it's one of the highest researched Ayurvedic polyherbal combinations. So Triphala is mostly researched as a rasayana drug, rasayana, which works on the cellular metabolism, the cells and their working, and how different organs in our body have different cellular structures, and then the action of Triphala on affecting the enzymatic release, the cell health, the cellular health. A lot of multiple ways Triphala is being researched upon. So today we are going to talk about diabetes. Why diabetes? Because it is, of course, a burning issue. It is a havoc maker. So Triphala is understood as, it has been accepted as anti-diabetic combination, anti-diabetic formulation, because of its antioxidant properties, anti-inflammatory properties, its immunomodulatory properties, its gastrointestinal protective properties, hepatoprotective properties, its wound healing. So lot of all these qualities are found in that simple tree drug, Haritaki Bibitaki and Amlik. Now, Haritaki is given the predominance in this. We'll see forth how it works. So in my first video also I have shared about the liver and its health. So hepatoprotective property of Triphala is extremely important for it to work as an anti-diabetic formulation. Now, what does Triphala do? It reduces the oxidative stress, the excess stress that our body undergoes due to multiple things, due to the lifestyle, due to pollution, due to age, due to genetics, multiple reasons. There is a stress working on the different organs in our body. Now, when this stress is something that our body cannot bear, or it is not provided with certain amount of nutrition or lifestyle or thought process or sleep to combat the stress levels, oxidative stress, the oxidation in our body increases. Not going much into the technical details, Triphala basically protects your cell, your cellular mechanism. It reduces the oxidative stress. Now, in diabetes, what happens? Since it is a disease that, if it is present, it can cause PCOD in young women. It is the reason that obesity is so difficult to handle. It increases the insulin resistance. The body is not able to intake the glucose. So very depleted energy levels, but very high glucose. There's a lot of glucose, but you're not able to use it. That's why you're more hungry. So more glucose, you need to eat more, ending up in more glucose in the body. What does the body do? It starts, insulin also deposits the excess of glucose. What to do? The body, there's so much of glucose. What does it start doing? It starts depositing the glucose in the form of fats. So fatty deposition, obesity due to diabetes, then cardiac health. Very important, this combination of diabetic and heart condition. These two are a very fatal combination because in both these conditions, the very important parts of our body are hampered, namely the liver, the pancreas, and the heart. So all of this happens mainly because when you're eating food, what happens is our digestive enzymes are acting on it. Now, Triphala starts slowing down the digestive process. In most diabetics, you will see that they get hungry very fast. Every 2 hours, 3 hours, they will want a snack, they will want to eat something. Otherwise, they feel nauseating, they feel hypoglycemic. It is not just a habit, it is their body calling out for help. So, what does Triphala do? In a certain amount, not in a very minimal dose, in a certain increased amount, morning and evening, or at evening at a certain dose, according to your Ayurvedic physician, The quantity of Triphala can be set as per your body weight and your Prakriti. Triphala starts working on reducing the excess enzymes, the excess digestive enzyme. Now, faster digestion means what? Faster breaking up of your food, faster conversion into carbohydrates, into glucose. So the faster conversion, the faster is the glucose released, and then the glucose in a certain amount gets absorbed in your body. You feel okay for a while, but again, your hunger boosts up because there's not enough glucose for your cells. So there's a lot of insulin circulating. Your pancreas are, they are squeezed. The insulin is getting squeezed out. They are tired. The liver is tired because there's so much of fat on it. So here the Triphala starts working. Not just as a preventive method, as a curative element. It starts treating the diabetic reversal. So this is the quality of Triphala because it works on the pitta of the body, the pitta and the kapha. The pitta is the enzymatic action, and kapha, you can say it is close to the lipid and the cholesterol. So the pitta is something which is essential for maintaining the digestion, maintaining the waste matter removal, maintaining the gut health, and very importantly, maintaining the blood health. So in this action of Triphala, where it is an astringent, where it controls the excess fluid, excess acid secretion, which we saw in our previous video about acidity and all those complaints. The same way, the astringent, the drying, the lekhana property of Triphala helps to reduce the excess acidic secretion, helps to combat somewhere the glycation process. So when this is done, somewhere the insulin secretion is reduced. When the insulin secretion is reduced, it is acting as a friend for your pancreas. It is acting as a friend for your liver. So it is one of the best friends that you can have. No other friend can do that, I guarantee. So it enhances the insulin secretion also. In certain cases, it enhances the insulin secretion of the cells and thus helps your balance in your body to make you fight your blood glucose level. So especially for those who have a spike after eating food, a high postprandial level. So when there is a high postprandial level means there is too much of glucose in the body. It is not getting absorbed. So it works on that. Or it also works very well on the fasting glucose level. Or even if you are fasted for 8 hours, your fasting might show somewhere around 250. So that fasting blood glucose spike shows that the inner mechanism of digesting the glucose and making it available, that is somewhere happening. There's always too much of glucose in your body, even after fasting for 8 to 10 hours. So that is why Triphala is working. And of course, where it is working is our gut health. So we'll get to that because the gut health is something without which none of our body organs can work well. Now, Raktam Jeevam Iti Sthiti. Ayurveda says that our blood, a healthy blood, shows that your life is in good condition. Your health is in good condition. So Raktam Jeevam Iti Sthiti also maintains that where is your main organ of the blood? We teach our children, we learn in school, which is the pumping organ of our body. That's your heart. The vasculature is a highly blood circulated organ. The same with the brain. So the vasculature in the heart and the brain both are effective and affected by the Triphala. Why? Because of the blood. Now the blood is passing through the arteries and the veins at a constant flow. Sometimes we are stressed, the veins will increase, the arteries will increase their girths. Sometimes it will come back to normal. Sometimes it will reduce to increase the blood flow required to that certain organ. So stress and relaxation help to modify the squeezing of the lumen of the arteries and the veins. Now, according to Ayurveda, this is where the health of the arteries and the veins comes from the blood. The blood is also carrying the fatty molecules. All your lipids, your fatty molecules, your cholesterol is all circulating through the blood. We see it on the report, but where is it? On the report, we see HDL, LDL, triglycerides, but where is it? It is secreted by the liver, but it is flowing around in your body, in your blood. So in that sense, when the lumen, when the flexibility of the vasculature, the flexibility of your arteries and veins is compromised due to age, due to stress, when there has been too much of pumping all the time, there has been very little relaxation. There has been very little nutritional support to your vasculature, to your heart health, to the arteries and the veins. to your excessive thinking or excessive stress or hypertension, too much of blood going at inside the arteries and the veins which are circulating in your, which are maintaining the circulation in your brain. So what happens over a span of time? They start to harden. When something is not nourished properly, the tendency of vata becoming more dominant is very specifically seen. So when anything hardens, there is a very easy way that it can have a wear and tear. It can get cut. A hard thing can get a cut very easily, or a very deeper scratch. But something which is flexible, it won't really get cut so easily. It will heal very fast. When there is hardness inside, on the inner side of your arteries or your veins, when there is hardness, there is tendency of the fatty molecules to deposit. So excess of lipids and excess of triglycerides that are circulating in your body, along with lack of exercise, lack of proper diet, lack of proper relaxation, the fatty molecules start, the bad fat, the LDL, that somehow starts increasing. Triphala has been shown to work on increasing your HDL, the high density lipids. It works on increasing the good fat, reducing the triglyceride, reducing the cholesterol. So when the fat deposit starts happening, the bad fat starts depositing itself. When it starts depositing, it starts forming plaques. So we know what happens after that. There's a blockage, then whatever, in whichever form it expresses itself. So Triphala is working on the liver because the liver is the source of the fat in the body. Liver is the source of the glucose in the body. So the liver is a very important part. That's why it's said it's one of the major important parts of your body to keep your body in a balanced state. So Triphala acts by helping to remove the internal plaque formation. It is extremely beneficial in wound healing. Any sort of wound in the body, external wound, cuts, tears, any infection, any rashes, anywhere that there is a wound, Triphala is a very good antiseptic. So internally also it does the same thing because it is absorbing the excess fluids. Now in this heart mechanism, Triphala is working because of Haritaki. Haritaki has shown why it is abhaya. It is known as abhaya. It is known as something which is which gives you the fearlessness to combat your disease. It gives the fearlessness to your body. It gives the bravery, the strength to your body to combat disease. So Triphala is also compared to atorvastatin or the statins. Statins are given to reduce your pressure, to reduce your lipids for those who have hypertension. So Triphala has been found to work equivalent to atorvastatin or the other statins that are used because it helps to reduce the excess bad fat. It helps to somewhere enhance the flexibility of your vasculature, of your arteries and veins, because it is helping to enhance the quality of your blood, which is somewhere processed also in the liver. The fat is processed in the liver. So Raktam Jiva Miti Sthiti is balancing the vasculature in the liver, the heart, the brain, because of cardio health, for cerebral health, because cerebrovascular diseases, cardiovascular diseases, you must have heard, it is always vascular. Vasculature means the pipes, the channels, arteries and veins that carry the blood. So this is how, with enhancement in good fat, you can have a reduction in your triglycerides, you can have a reduction in your bad fat, you can have a reduction in your cholesterol levels, given that you are also following the required protocol that is mentioned with Ayurveda, the Dinacharya, the Ritucharya, the night Ratri Charya, what time you have to have your dinner, what time do you have to go to bed, and preferably to even avoid certain these conditions, because as a doctor, in my 18 years of experience, I've seen that those who really want to heal themselves, not get dependent on medication, there are very few, but those that are, they do it so beautifully with Ayurveda, diabetic reversal, cardiac health enhancement. There are so many patients, IBS reversal. So this sort of thing is something which is, you have to feel it. To maintain your health, you have to feel that you have to make changes in your diet, in your lifestyle, in your thought process to help that, along with preventive medications, preventive herbal combinations like Triphala. Now, Triphala is a combination that has to be, added on with different with certain add-ons. You might, according to your prakriti, according to the season, you might need it with ghee. You might need it with hot water. In certain seasons, it is advised with jaggery. In certain seasons, it is advised with honey, or you can just steep it and have it in the morning. But on a general basis, just maybe around 5 grams of Triphala with hot water at night, or 2 tablets of Triphala, which are from a reputed company, which are not inducing, crunching bowel movements that are seen with most Triphala combinations when they're added with senna leaves to have a laxative effect. Please do not go in for that. Laxation is induced laxation is not at all a good thing for your body. So we will talk about that in the next slide. So Triphala on a daily basis at night before going to bed helps you to enhance your anti-diabetic properties, anti-cholesterol properties, anti-lipid properties, and also protective cardiac health. So a bowel movement is something that is the that is the ultimate aim of certain people as I've seen in my practice. If they have a good bowel movement in the day, that day is fine. They are so happy because the gut is the place of Vayu. Vayu is the bioenergy that is helping me talk. It is helping you watch. It is helping you think. Any movement in the body. So the bowel movement is something that is attributed to Vayu. Any movement is attributed to Vayu. Now, when the bowel is clear in the morning, automatic natural Vayu will enhance your hunger, because then the Vayu will be balanced. So your Pitta will be in a normal state. It will enhance your digestive fire, and you'll be hungry. You're having healthy food, and the entire system is balanced. So a good bowel movement in the morning is extremely essential. Constipation is a very common problem. May it be food, may it be lifestyle, may it be age, may it be certain changes in your body. So constipation is something that more or less anybody after 30 or 35 is always more or less facing, and they start with something as simple as Triphala. But they do not realize that the Triphala that they are taking, if it is really causing a purge, if it is causing 3 bowel movements, 2 tablets of Triphala, or maybe 1 small teaspoon of Triphala is causing a purge, then that Triphala, of course, has been somewhere compromised. The quality of the Triphala has been compromised by adding certain ingredients like senna leaves or such to enhance that purge, because they are intestinal irritants. Now, only consumption of Triphala should induce maybe 1 to maximum 2 bowel movements in a normal person. Or in certain people, it might not even have an effect. It might just have a normal bowel movement, but it takes time to work. So for a happy gut, to have a happy intestinal condition, to have a happy small intestine, large intestinal health, diet is extremely important. Avoiding foods like maida, chana, or heavy dals, non-veg, dairy, sweets after the sun has set, after the Suryasta, when the circadian rhythm of your body is in its sleep mode. Avoiding these foods helps the body to energize the gut. Waste matter removal is extremely important in your body. If you keep on forcing your body with different types of food, your waste formation will become very slow. Removal will become very slow, and that is when the free radicals in your body increase, the carcinogenic tendencies increase, the irritable tendencies increase. So your food at 7 to 8, within 7 to 8 p.m. is the ideal time to ensure that you have a better bowel movement in the next day. Adding Triphala along with that enhances with the multiple properties of hepatoprotective, gastrointestinal protective, and so on and so forth, like we have discussed, cardioprotective. So Triphala can work its wonders because there is space for it to work. So for the happy gut, it is very commonly found that most of the conditions like IBS, where constipation is a problem, either it is constipation or it is, diarrhea, either of these two things. Either you're not passing stools for 2-3 days, or you're having a bout of, diarrhea similar activities where there's a lot of bowel movement all through the day. So stress-induced ulcerative conditions, ulcerative colitis, IBS, gastric ulcers, Triphala's wound healing properties work here. Anywhere there is a wound, Like I explained, on the outer surface, on the inner surface, on any lining of the organ. The Triphala is a very good wound healer because of its astringent properties. It dries up that place, it improves the cellular mechanism, it improves the healing. So with Triphala, it as a gut booster for those with constipation, initially it might not work. Now, if you're a severely constipated person who has a very high constipation condition, Triphala might not be your option. You might need to work out with something like castor oil or the medicated decoction of castor, Gandharva Hastyadi Kashayam or Gandharva Hastyadi Tailam, after consultation with your Ayurvedic physician. Triphala is something that you can take it safely without a consultation. You can take it. If you take it with hot water, if you can soak it overnight and take it in the morning, see how it's working on your constipation. Or those who have a tendency to constipation. So in that sense, it helps to enhance your gut health because your gut is connected to your brain. Whatever is happening now, healthy gut, a healthy bowel movement is directly connected to your uh, good feel receptors, to your serotonin, dopamine release, because all of that is from the intestine. So when that is healthy, when your intestine is healthy, then your feel good factors, energy positive factors, all of these are enhanced. So your gut health is equal to your mental health. And that's where the complete idea of Ayurveda comes, that the mental health and the gut health both together, the physical health both together will make a healthy individual. So this is what the gut tells us. The microbiome in our gut is telling us. The flora, healthy flora in our gut is telling us what to eat, when to eat, and the following of certain dietary protocols. So that was all for today. This is my share on Triphala in the second part of the Triphala series. I hope you all gained some information. You will be, you can talk to your Ayurvedic physician. I have shared my number for those who wish to contact me. Let us see how Triphala works in enhancing all of our mental health, digestive health, cardiac health. And I'm sure following such things, such small tips and changes in your diet, trying to bring a change in your environment around you, the family around you, that is my only motive of making these videos. So that as adults, we know that we need not always, depend on chemicals and other sort of chemical-based formulations, but rather a more healthier, natural way of understanding your body, taking certain medications so that the body is balanced, not depending on the medication, thinking more about yoga, about diet, lifestyle changes to reduce all the stress that we have anyways to face. So that was all for today. Wishing you all a good day, and see you in the next video. Thank you so much. Goodbye.